And the trial of Lindsay Clancy has raised awareness about maternal mental health, including postpartum depression and postpartum psychosis. With us now to talk more, we have Kristen Curry, a nurse practitioner with the Sharp Maternal Mental Health program. I want to thank you for being here.
Thank you for having me.
First of all, you know, we've been talking a lot about this ever since the trial kind of went underway. And the first question I want to ask is, how common are mental health conditions among new moms, and not even new moms? It can just be, it's just a stage in life, but if you can answer that.
So quite common, actually. When we're talking about maternal mental illness, we use an umbrella term, perinatal mood and anxiety disorders. And this encompasses several mental health conditions that can happen during pregnancy and in the postpartum period up to that 1 year mark. And common conditions we see are postpartum depression or perinatal depression happening during pregnancy, anxiety disorders, perinatal obsessive compulsive disorder we can see, and even post-traumatic stress disorder that can be related to, you know, a traumatic delivery. There's some of our more common, specifically the depression and the anxiety. They're the ones we hear and we talk about more often. There are more rare conditions that we may see, like bipolar disorder, or one that I really want to mention, I think is important to bring awareness to, is a very rare but very serious condition called postpartum psychosis, which is considered a psychiatric medical emergency.
Okay, and I'm glad you bring this up because we've heard that term thrown a lot around in the trial, and so a lot of people are like, what exactly does that mean? So if you can explain what that means, and then maybe some of the symptoms.
Yeah, of course. So postpartum psychosis, as I mentioned, is a medical emergency, meaning when somebody exhibits symptoms of this condition, it requires urgent evaluation and treatment. This condition, we don't necessarily understand why it happens. There might be a slew of factors, including the biological changes, hormonal shifts after pregnancy, sleep deprivation, and some genetic vulnerability, including a history of, you know, bipolar disorder, specifically bipolar 1, schizoaffective disorder, or a family history. But it can happen to women without any mental health history. And generally, when this happens, commonly we see the symptoms arise within the first couple of days to 2 weeks after giving birth. Those symptoms can occur a little bit later on as well. So that's just a general thing. Some symptoms that we may see that are big red flags that I think it's really important for especially partners and support people to be aware of is if the mother is exhibiting a drastic change in mood. They maybe are not sleeping with a decreased need for sleep. So it's not just being disrupted by the baby, it's having a lot of energy and not being able to sleep at all. Disorientation, racing thoughts, confusion. Some people in this state will experience hallucinations, which are maybe hearing voices that other people cannot hear or seeing things that other people cannot see. And one thing that's very concerning is the delusional thoughts that can happen, meaning there's this disconnect from reality, these fixed false beliefs. And that is what makes it so incredibly dangerous if left untreated.
Right, and so if you're a family member, whether it's the spouse or maybe a friend, what do you do in that moment? Because I feel like you have to be a little careful, right, to go to mom and say, I think you're going through a postpartum psychosis. Like, that's just not something that you say out loud. So how do we go about helping them?
Totally. The first thing to do is validate the mom and support the mom and how she's feeling. I see you're under distress. We never want to invalidate their experience or say, hey, you're in a psychotic state, right? Because they probably don't have that insight or recognition of what they're actually going through. Another big thing is safety. We want to stay with the patient, keep the baby safe. If she is unwilling to maybe go to the emergency department, then I would say stay with the mom and maybe call emergency services to come to you. But at the end of the day, you want to stay with mom, keep baby safe, and validate her experiences.
I know obviously we're talking about something very specific in terms of psychosis, but in terms of postpartum depression, I feel like maybe there are a lot of moms out there who don't know how to identify it, and therefore it goes untreated. So what does treatment look like, and what do you tell moms out there who might be feeling that kind of way?
Yeah, so I'll start with something called the baby blues, which is something that happens to a lot of women after giving birth. This is maybe tearfulness, feeling overwhelmed, anxious, some sleep disturbances, and these symptoms are generally transient, meaning they go away with time. But when symptoms are persisting, this sadness, guilt, hopelessness, fatigue, sometimes suicidal thinking, disconnect from the baby. If this is going on past like a 2-week mark and it's starting to impact your ability to function, please seek treatment. There are psychiatric professionals. It could involve medication management and psychotherapy. If there's something going on like postpartum psychosis, this is considered a medical emergency. So this is not treated on an outpatient basis, you know, with an outpatient psychiatrist or nurse practitioner and therapy, at least initially. That person, it may involve hospitalization, like in an inpatient setting, in some cases mood stabilizing medications or antipsychotics to stabilize the condition. And then once stable, you know, it would be highly recommended for mom to continue treatment with an outside provider, like a psychiatrist, nurse practitioner, and therapy, and just continue that care moving forward.
And when you say that it's common, not the psychosis part, but postpartum depression, like you said, anxiety, OCD, how common are we talking?
So when we're talking specifically about postpartum depression or perinatal depression, it's very common and likely underreported. So what we do have, we actually think that number may be lower than we're actually seeing. So it's about 20%, or 1 in every 5 to 7 women may experience postpartum depression. So it's very common. Postpartum psychosis, on the other hand, that's 1 to 2 per every 1,000 births. So we're talking 0.1 to 2% versus that 20%. So postpartum depression and some of these anxiety disorders are very common. And the good news is they are treatable and recovery is possible in all of these conditions.
So if anyone's at home and they're hearing this and they're thinking about their loved ones, if they have questions, essentially call your provider.
Absolutely.
Okay.
Yeah.
Oh gosh, I feel like we could talk for so much longer, Kristen. But I do appreciate your expertise. Thank you for coming in and shedding some light onto a topic that a lot of us, I feel like, are still kind of in the shadows about.
Totally.
Thank you.
Thank you so much.